We're back here now, 22 News in Focus, and today we are talking about the March of Dimes and the work they do to support babies and their mothers with both pre- and postnatal care. Our guest is Stephen Sykes, the Senior Development Manager for the March of Dimes for the Boston, New England region. So if someone is considering having a baby, what should they know or be doing to plan ahead for a healthy pregnancy and baby?
Thanks, Don. That's a great question. Well, first of all, I'm not a doctor and I don't play one on TV. So, if you're pregnant or thinking about becoming pregnant, the first thing you should do is you should reach out to your doctor, right? Schedule an appointment. We know that quality and frequency of prenatal care means better birth outcomes. That's the first thing that you can do. Before you do that, I would say before you go out and buy all the books and spend all the money, go to the March of Dimes website, marchofdimes.org. Our 80 years of history and 80 years of information is on there. It's vetted information, it's good information. Everything you want to know about pregnancy or complications or, boy, is this not feeling right, is all on marchofdimes.org. Tons of information. So the two things I say to do if you're pregnant or think about becoming pregnant, A, make an appointment with your provider, your doctor, your doula, your midwife, and check out our website, marchofdimes.org. Everything is on there.
I want to talk about health equity. You kind of touched on this in our last segment, just talking about different disparities when it comes to, different groups of people. Does premature birth impact some groups more than others? Are there disparities in your research?
There absolutely are, and thank you for saying that. That's part of the work I'm most proud of. So the preterm birth rate, this is defined what premature birth is. That's being born less than 37 weeks, down to about 22 weeks, we think is probably the age of viability. Across the country, it's about 10%, 1 in 10. 10% of all babies are born premature. The state of Mass is around 9%. However, Springfield hovers around 11%. So first of all, it impacts everybody, but yes, it impacts some moms more than others. Moms of color, Black and brown friends, have much higher rates of preterm birth and a significantly higher rate of infant mortality. So we know, our data shows this, the trend in Springfield is Black moms in Springfield have an infant mortality rate 3 times the state rate. And infant mortality, by the way, is a nice way of saying that babies go to heaven and don't go home. So the work that we do, we codify that, we report it, we document it, and then we have honest-to-God conversations with stakeholders, with the folks in the State House, with companies, with providers to really address that. But yes, it absolutely impacts moms differently.
And I know I did a 22 News I-Team report on premature births here in the western part of the state, and that's on our website at wwlp.com. You can check that out under the investigation tab. What kind of support programs does March of Dimes provide to pregnant mothers and their partners and families?
Yeah, so many different things. The 2 ones I'm most proud of in our area. One is called supportive pregnancy care, and we actually partner with Bay State where we do that. That's where moms who may have different issues, maybe transportation issues, maybe trust issues with the hospital, come together in a group. Again, we know quality and frequency of prenatal care improves birth outcomes. So that group of moms of the same gestational period meets once a month for their prenatal care, as well as good health education. Now, the beauty of this is twofold. The moms form great friendships with each other, and it becomes a new social network for them. It becomes a new sense of social support, really helping address social isolation issues. And also, there's no waiting in the waiting room. So if 12 moms have an appointment, standing supportive pregnancy care meeting at 7 p.m. in the doctor's office, there's no waiting. Walk right in, you can bring your siblings, and you get really good access to care. So that's one thing that we're doing. Moms and families and dads who are in the neonatal intensive care unit, or in the NICU, we offer what's called we offer what's called NICU family support. And what that is just what it says. Essentially, providing education and emotional support for moms who are there, really trying to help them be better parents when they go home. If you can imagine being in the NICU, it's a very scary time for moms and dads. The doctors and nurses are fantastic, wonderful. We try to help in that by providing classes, and really a place to listen and talk. So those are the two key things that we absolutely do. I could go on forever about the other stuff that we do, but those are the two hallmark issues that we do in the area.
And real briefly, if someone's wondering, explain what a NICU is.
Yeah, so the NICU, neonatal intensive care unit, took me a while to figure out as well what it was. Babies who are born way too soon and way too sick go there. Again, a normal pregnancy is just about 37 to 39 weeks is what we hope. So if a baby is born south of that, 35 weeks, 32 weeks, they go to a special intensive care unit in the hospital where it's just that. They get complete world-class care here at Bay State. So it's a wonderful program. You don't want to have to go there, but if you do, you know you're at a great place, which is at Bay State.
And unfortunately, some babies don't make it, and this is something that the entire family is it goes through. It's painful. Are there any programs that you guys have that help people, get past this, move through this?
Yeah, there are. We have support groups online. One group's called Share Your Story. But there's comfort in numbers. So if folks form and join our online community, Share Your Story, they can talk about that. Secondarily, we see a lot of people, as painful as it is, and believe me, I know how painful it is. I can only imagine. Doing something positive out of that. So we see, and we try to provide people an opportunity to volunteer back at the NICU, or maybe volunteer at the March of Dimes, or maybe do the walk, or do something in memory of, to do something positive out of something that was so painful. So we try to provide that platform as well. Often it's just, someone to call and listen. I hear a lot of stories and I cry a lot because it's very painful, but we try to provide that to folks who go through the worst possible outcome for anybody.
After a short break, we're going to learn more about this year's March for Babies. You're watching 22 News in Focus.